Welcome to Teacher Development Webinars. My name is Amanullah Sand. I facilitate virtual programs in Teacher Development Webinars. And Teacher Development Webinars is actually a social action project implemented by British Council Active Citizens in Pakistan as a response to COVID-19 crisis. And it is an initiative to support teachers and educators around the world as professional development opportunities. But as you know, that October is celebrated as Breast Cancer Awareness Day. We are live today with a special webinar about awareness and mindfulness techniques, that how to cope with the situation. We are thankful to our responsive master English training for sponsoring our Zoom account. Thanks again. And today's session will be moderated by Gulerana Afridi. What do you think?
Bismillahirrahmanirrahim. Assalamu alaikum, everyone. So today, I hope I'm audible right now. Am I audible?
Yes, you are.
Okay. So today, we're here for this session for mindfulness and resilience with breast cancer awareness. I will be moderating today's session, the hour-long session. My name is Gulerana, and I'm from Peshawar. Today, over here in our panel, we have Dr. Tayyba Ali and Rochelle McLaughlin. These two women are, I am so glad, and it is such an honor to have these women today in our session. So first of all, I'm going to introduce Dr. Tayyba. She is, okay, so Dr. Tayyba is an MBBS, FCPS, General Surgery and ex-consultant, Azra Nahid Medical College, Superior University, Lahore, ex-assistant consultant at Dr. Suleiman Al Habib Medical Group, Riyadh, Kingdom of Saudi Arabia. Currently, she is based in Australia and is a member of Australian Medical Council. She is also working as an observer doctor at Delhi Polyclinic Group of Free Online Medical Consultation. Thank you so much for joining us today, Ms. Tayyba.
Thank you so much. It's my pleasure.
Our other guest is Rochelle McLaughlin. She is the founder, coordinator, and lead instructor for the Advanced Certificate in SJSU's Advanced Certificate in Applied Mindfulness, which is a program open to all healthcare and human service practitioners worldwide. Ms. Rochelle received her certification to teach mindfulness-based stress reduction from the Massachusetts Medical School Center and for mindfulness, and has completed her advanced studies in psychology and is also a yoga instructor. Thank you so much for being with us over here, Ms. Rochelle.
Thank you for having me. It's an honor to be here.
Okay. So we're going to start with our session. First of all, it's about mindfulness and resilience, and also about breast cancer awareness. Now, of course, mindfulness and resilience, these words, they hold certain meaning, and that is why these women in our panel are going to be here, and they are going to, through their own experiences, through their own learnings that they have had in the past years of their performing in their position. They're going to let us know what mindfulness is, self-aware, and just generally know more about breast cancer. Because as we know, in Pakistan, every 1 out of 9 women are diagnosed with breast cancer. First of all, I think I'm gonna keep the floor open for the both of you, and I am gonna leave it for you to just briefly, on your own, to all the people that are watching right now, just briefly explain what mindfulness is and what resilience is in your own definition. Thank you.
Sure. Dr. Tayyba, would you like to share first, or would you like me?
Yeah, you can go.
Okay.
Yeah.
So mindfulness, in the lineage that I've been taught through mindfulness-based stress reduction, the definition is that it's the practice of bringing our awareness into the present moment and in a non-judgmental way. And it sounds really, really simple, and it's not so simple as anyone who's ever tried to integrate mindfulness into your life. It's not so simple, particularly in these challenging times. We live extraordinarily complex lives. And the particular difficulty is that non-judgmental piece. And so we are actually cultivating specific attitudes of compassion, gentleness, and kindness towards ourselves anytime we're integrating mindfulness in our lives. And that is a part of the resilience, in the sense that, as we can use the sensation of our breath and our body as a way to anchor ourselves in the present moment, so that in the midst of the storms of life, whether that be diagnosis of cancer or a loved one that has cancer, or managing the crisis of our time, all the crises of our time, that mindfulness helps to ground us in the moment, in the present moment. And we can use the powerful awareness of our breath and our body to anchor us, to ground us, and to give us stability and a sense of connection to our inner resources of clarity and insight and courage in the midst of life's storms.
Thank you so much, Rochelle. Thank you so much for your input. Now, Ms. Tayyba over here has prepared slides on mindfulness that she is going to be sharing with us. Ms. Tayyba, please go ahead and share your screen.
Thank you so much, Rana. Actually, I have prepared slides related to some like breast cancer, like what the breast cancer is, or what are the different breast. Can you hear me?
Yes. We can hear you.
Okay. So like what the different breast diseases are there, and which our women should be aware of. It's not just only breast cancer, which they should know. Definitely that is a big thing they should know of. But there are different diseases also which they should know of, and they should be having knowledge about them. So I will try to concise it as much as possible in a layman terms, as I can explain. Yeah.
Yes,
so
that would be wonderful, because let's try to connect mindfulness and resilience with breast cancer awareness, and that would be great.
Yeah. So as we know, like we are celebrating this seminar or this live webinar because October is the breast cancer awareness month, and everywhere in the world it is goes like this. They are doing marches, and they are like, holding some seminars and trying to create awareness in everywhere in the world, not only the underdeveloped or developing countries, even in first world countries, everywhere they try to do that. So I just collected a bit data of the Pakistan, if I can open this link, and like, okay. I just wanted to share something. Like I just wanted to show here, like if we see here, the data collected in Pakistan, it was in 2019, and the females which were suffering from breast cancer, ratio of the different diseases they show, it was 30.8%, which is a big ratio. And other diseases of 46%, other I will not go in that. And here we can see that it's how our curve is going straight, or it's like, it's not like it's coming up and going or down, like the disease is coming and going and like that. No. So it is a big thing for us. Similarly, here we can say it's our females, how much big number is affected, by the breast cancer only. And here the WHO report, they have told us, like, if we have any operational cancer policy, strategy, action plan, to their assessment, we don't have. They say that. If we have a cancer registry, they say we don't have. So it's their assessment, but we have some definitely foundations going in our country. They say, like, as an operational policy strategy action plan for reducing overweight obesity, they say, no, we don't have this plan. Yes, a bit, this is true, not bit, it is true. Anyhow, other than they say has an operational policy strategy action plan to reduce physical activity, promote physical activity, no, yes, this is true. And then they say harmful use of alcohol prevention and control alcohol is not in our. Fine, so alas, we can leave it. Then they are saying cancer screening and early detection. Are we doing pap smears? We are not doing. Are we doing breast cancer self-examination, breast palpation? It is not generally available at the public primary healthcare level, which it should be. And they are saying mammogram is not generally available at the public primary healthcare level. It should be. So I will just go back. So I can't close it.
Sorry to interrupt, Dr. Tayyba, but your screen was struck, and I think, if you can make it in slideshow, it would be better.
I can't hear you, Manala.
Well, I said your screen was struck for a bit, and if you can make it in slideshow, it will be better.
Okay, sure. Okay. Anyhow, okay. So this is some important data which we collected in. Yeah, it's okay now. Is it okay now?
Yes, it is.
Yeah. Okay. So I will just say, like, if we see in 2019, we can see how much the ratio we have breast cancer. It is about in Lahore only 46%. And similarly, there are different data they collected from 2000 to 2009, and they said that 6,718 patients were reported having breast cancer, which is a big thing. But they said, yes, they are having some Pakistan Health Research Committees. They are working under some National Health Administration's control and coordination under government of Pakistan. But still, we need to work a lot, Then I would like to just tell that any female who comes to us, we should know that, or she should know that it's not only the breast CA, which is there, breast cancer, which is there. There are different diseases. Like, we should tell them there are benign diseases also and different inflammatory diseases also. But we are more concerned about benign diseases, which is a simple lump, and the malignancy, which is a definitely bad thing to have. Okay, if a female presents with a benign disease, how we can assure her that it is a benign disease, or she can say it is a benign lesion, just like it will be, it can be a very small swelling. It will be very, very well localized, and if she feel it, it will be just like a small swelling in in the breast. It would be like, we call it breast mouse. There will be no other lymph node if she feel in her armpit, and it can be just 2 to 5 centimeters, that's it. But it will be very, very benign and very firm, smooth, and no, like, it will, she can say, okay, fine, this is the good one, like, it's not the bad thing. And if we try to compare how the female can say she's having malignant lump with the benign lump, or the malignant swelling with the benign swelling, malignant lump, if a female will feel it, it will be a bit harder in consistency. She can feel that it's like a stone, and then mostly it is painless. Sometimes if it is inflammatory tumor, they rapidly growing, they can be painful. And it will be having, along with that, some nipple discharge, some problem in her skin and areola, and then, okay, and then she can say, okay, this is like malignant, she herself can judge it. So the important thing is, every female should know what are the different risk factors which she can have for development of CA breast. Some of important ones are, if they are 50 and older, in any case, if patient 50 or older, we say she or he is a risk having any type of cancer. So if she's having dense breast, she had her first period at early age, if she was previously diagnosed with cancer, any type of cancer, then breast cancer risk development is much more. Hormonal therapy, if she used ever hormonal replacement therapies after menopause, she's increased risk of developing breast cancer. Then if she had her menopause at late age, after 50s or maybe in 60s, 60s rather, we can say, then she has increased risk of developing breast cancer. Then if she has her first mother, sister, daughter, sometime aunts or grands, the breast cancer, that lady is at higher risk of developing breast cancer. And there are some genetic tendencies, if they're BRCA1, BRCA2 positive, they're like, for us, then definitely she is at risk of developing the breast cancer. So here is just when a female is doing her what we say breast self-examination. So these are the most important quadrants she should be palpating to look for where the she can have the breast lump or breast cancer. So most important one is the upper autochondrite, which is 60%, and it's very difficult to feel any lump under the nipple and areola for herself. For that, she need a doctor checkup definitely. So I just want to talk about the in situ cancer, because in situ is the one, if we diagnose it very early, then we can prevent our ladies going towards the invasive cancers. So for that, it's just located in the ducts and it is diagnosed only by mammogram, not by physical examination. A lady herself cannot detect it. So that's why in this case, we recommend mammography should be routinely done. So that is saying this is also a slight chance if a woman has this type of cancer, she's at risk that it would occur in other, like in one side, then another side she can have it. And it is more common among the premenopausal. Premenopausal means before 50s, like that. I'm sorry. I'm so sorry. Okay. And then if we talk about the where it can go, it's not like female should know. If they say only it's in the lump in the breast, okay, fine, no problem. No, it can spread to her armpit. It can spread via the blood to different parts of the body, like lungs, brains, bones, especially very important, even sometimes to cervix, and especially also to the lymph nodes of the body. So she should be very, very careful. It's not only the breast that will be a confined area of a tumor. So that's why if it get advanced, then we have to go for multimodal therapies to treat this one, Then if we have to diagnose the breast cancer, what we use the triple regime. That is, first comes the clinical examination, that is by the doctor, definitely. And imaging is done, ultrasound or mammo, depending on the age, and then the biopsy is taken. Either it's mammographic or FNAC or like true cut biopsy, depending on how the physician wants to do. Then mammogram, why the mammogram is important here? Because it is the best screening test till now, although it has some of the false negative rate, like 1 out of every 1,000 women is screened for cancer, it's saying, and it can be some false negative, false positive rates. But even then, it is the best screening one. It says if we do in this much ladies, 7 will be diagnosed with the cancer. And it should be started at age 40 if there is any family risk present. If no family risk present, we can start it at 50. Usually it is done at 50. And it says find out if you're high risk by sharing your family history and personal family history. So high risk are these ladies, as I told before. So they will be starting the mammogram earlier age 40. And then it says understand the benefits, risks, and limitations of breast cancer screening. Mammo will find most, but not all breast cancer. But still, we should go for it. Okay. Then these are the, I just want to tell, these are the breast cancer symptoms. If a patient sees herself and goes for breast self-examination, then how she can recognize she's having any lump, that is, she can have a swelling, she can have problem in her nipple, there can be nipple discharge, a dimpling, nipple can go inwards, there can be redness, rashes, or different skin changes, So these are different stages of breast cancer. These are just, I will just tell, like in 4th stage, where the cancer is very, very advanced. And usually our ladies are coming, which I have seen in my career in these stages, 3 and 4 stages, where the tumor has been spreaded to different parts of bodies. And then we have to downstage the tumor and we have to go multimodal therapy. Then definitely it becomes for patients also to us to consult them and for us to, treat them. And we have to go for multidisciplinary team approach. So these are stages. Just as stage 4 survival is only 20%. But if you get diagnosed as stage 0, where there's just a small lump, or it can be ductal carcinoma in situ, 100% survival. Still at stage 2, it's 87%. So like if you get it, important thing is if you get it diagnosed early, still we have the good survival, Then if we go towards the management, it's basically multi-modal therapy. It includes our surgeons, definitely radiotherapists, oncologists who further dealing with the chemotherapy, radiotherapy, whatever we have to give, then pathologists, definitely what type of cancer it is, and what type of cancer and what treatment will be suiting for that type of cancer. Other profession, definitely counselors are very, very important in any type of cancer, in any type of, life-threatening disease, because this is a big psychological dilemma for any patient, and they need to have a very good counseling. And breast care nurses, definitely. Here in first world country, like in Australia, we have a very good, different centers who have only trained breast care nurses. So this is, I have written contraindication breast conserving therapy. We just give the breast conserving therapy only to the, we can say, early tumors. If the patient has had any previous surgery done, any previous radiation, or any margins are positive, or any cosmetic problem is there, then on tumor is more than 5 centimeters, then we cannot preserve the breast of that lady. Then we have to go for the advanced surgery. Treatment of breast cancer again depends on clinico-pathological factors, individual factors, social, geographic, and personal benefits and preferences, and physician factors. Because I have seen some of our patients, especially in Pakistan, they are very old, and their relatives or sons, they say, we don't want them to go for such advanced treatment, so just do something local, like that. These are again surgical option: lumpectomy, mastectomy, and axillary staging, central lymph node biopsy, axillary lymph node dissection, then lumpectomy plus radiation. These are multimodal therapies which we are doing according to the stage of the patient. DCIS again, if it is intraductal, very good, we can localize early, survival is 95 to 100%, and then we can go lumpectomy with radiotherapy. That is the best thing we can do, Again, the breast conservation therapy, lumpectomy and quadrantectomy, these are the two things for the early carcinomas. Then treatment options for early breast cancer, again, primary breast conservation therapy and adjuvant therapy, which are radiosystemic, chemohormonal therapy. Hormonal therapy, depending on our patients are premenopausal or postmenopausal, according to that, we give them the chemotherapy, the hormonal therapy. This is in research. Okay, so if we go to the how we can start creating awareness among our females, the important thing is we have to detect this early. And if a female comes at 40 years of age or 30 years of age, and she has any type of risk factor, even then that she don't have any type of risk factor, we should start the screening of that patient with the ultrasonography of the breast, other than the breast self-examination. And when she crosses the 40s or 30s, then she will be going with the annual mammogram or 2-yearly mammogram. Then breast cancer awareness, like how to reduce the risk and ways how we can reduce the breast cancer. Basically, like we have to educate our ladies, they have to maintain their body weight. That is very important, because obesity is very much related to all type of risk factors, all type of chronic diseases, life-taking diseases. Then exercise regularly, very important. Sleep, there are researches that say that if any female or any patient takes good sleep, at least at night, 8 hours sleeps, it start maintaining our metabolism and the hormone levels, especially estrogens and progesterone, at a regular circadian rhythm. So it helps preventing the development of breast cancer. Then limiting alcohol for our, this is for our here in these countries, breastfeeding your babies. It said that it helps prevent the spread or development of breast cancer. This one came for invasive breast cancer. It's like it can be invasive ductal, invasive lobular. Invasive lobular is a very bad cancer. If any patient has it, they should know they can have an other breast also. So 10% chance they can have other breast cancer. So in invasive lobular cancer, we have to be very vigilant. Then again, this is the locally advanced breast cancer. Locally advanced means stage 3, they're just up to the breast, into the lymph nodes and to the surrounding area. They're not spread to the bones, or we can say not to the liver, which we call the hepatic mets. So there we can either first downstage, we shrink the tumor with the help of chemotherapy or the radiotherapy. And then we go for modified radical mastectomy. It is just a new technique. Before there was total mastectomy. Like they used to remove whole of the breast, but now since previous few years, it is going only modified radical mastectomy, where we just remove the breast. We don't go for removal of muscles or like that, and then over that we can go for breast augmentation, breast reconstruction, and this followed by radiotherapy to reduce the recurrence of the cancer. These are indications of mastectomy, same like the stage 4 tumors. These are if distant mets, definitely. If distant met patients come to us, then we cannot do any surgery. Usually we just go for palliative. Palliative means we will provide symptomatic relief, painkillers, and combination different type of chemotherapies or radiotherapies, or if patient is premenopausal, then tamoxifen, like that. So this is the follow-up for every patient who is going for mastectomy in breast cancer, like every 3 yearly, then 2 yearly, then 5 yearly, and depending on yearly. And best self-examination, every case should be monthly done. This is the most important thing, should be done by the patient herself. Okay, so this is the most important thing, guys. I will say the most important slide here, like breast self-examination should be done by every female, starting, we can say, from 18 years till onward. Here, it is recommended it should be done by every single female, starting from young age. So these are like easier ways, like you can stand in front of the mirror, start examining your breast, first one, and then the second one, your armpits, all the quadrants. Then you should examine on lying down and nipple discharge. Sometimes there's no lump, there's bloody nipple discharge, then you should be vigilant that it is blood coming. You should immediately see your doctor. So what to look for when performing breast self-examination? A change from last month. Any lump is there, change in size or shape of the breast, is there nipple discharge, any dimpling, puckering, or dryness of skin, and localized breast pain. If there is localized breast pain, sometimes inflammatory carcinoma can be there. So you have to be very vigilant. So this is very, very important to be done by every female. Okay, so how we can raise the breast cancer awareness among our ladies if we talk about the third world countries or Asian countries? There should be done on 2 levels. First, it can be done by media, and then secondly, it can be done at the personal level. Because we know nowadays it's a media world. There are Twitter, there are Facebook, there are, everybody has the phones, you know, and they can approach to YouTubes and Facebooks and all the stuff. So we are living in a very good, you know, strata where we can create awareness in our females in a, you know, broad way. Before it was not like that. So it is very, very good way, especially the digital media, you know. This is like initial how we can also introduce we can start at the community level. We have to starting awareness at all the levels of communities. Our nurses, our midwives in the rural areas, you know, our schoolgirls and uneducated ladies, educated ladies, like that. And then if initially diagnosed, early referral should be there. If midwives see a patient that she is having any breast lump, it should be referred to a tertiary care center. Not they should be dealing in any regional center or like that, you know. That is very important. Then how we can spread online, like the simple maneuvers which we can do is like we can just start spreading on social media. We can share some pictures or videos which are related to breast cancer, like I said, on Facebook, Twitter, or Instagram. And if there is some patient we can find and their family, we can share a personal story about the experience of breast cancer she had by herself, by hiding the identity of the patient. Definitely that is very important. So she can tell how she, you know, developed these symptoms, what were the symptoms which she would like to tell others to be care of, and then she can post her story and how she went through all that journey, you know. And then we can start a website specially dedicated only just to breast cancer to create awareness that here you can go, you can find the latest data. These are the symptoms you should look for. These are the mammograms and screening strategies. And where are the different peoples you can contact? We should have the different panels working on these medias, doctors and specially trained nurses and midwives or training doctors, you know, where they should be wholly solely dedicated towards the breast cancer awareness. Then the raising in person, like how us at the personal level we can do it, like we can ask as just we can have the charity walks as we are having for different purposes. Then we know there is pink ribbon for breast cancer, and we can just ask, okay, friends and family members to wear the breast cancer on this breast cancer ribbon on this day. And this is the thing, like we have to get it, you know, rid of in our society. Then fundraising is very important because here in first world countries, it is mammography and the screening, whatever screening for any type of disease is free. But in our countries, there are so much economic problems that people cannot afford the simple tests, simple blood tests when they cannot afford. So if we will tell them, okay, you come for screening and we have this mammogram and the annual breast ultrasonography done free for you, please come to us. So they will definitely approach us because this is a big thing we have to address. Then definitely whosoever female get diagnosed with breast cancer, she should encourage her friends and families, or if there are other people who say, okay, this lady is having some problem, she's worried. So we should encourage her, no worry, this is fine. You go as early as possible and you will get diagnosed it earlier and you can get it treated as soon as possible. So if a friend or family member is hesitant, but going to a physician after to go with them, keep them company, provide them moral support. This is the most important thing. Psychological support and counseling is the most important thing. And then breast cancer screening is especially important females between 40 to 49. So we have to tell them. Then ask the doctor to give a group presentation on breast cancer, like we are doing, and we can have the big panels talking about different type of breast cancers at the patient level, at the individual level, in layman terms. Just talk to them, whichever language they understand. If they have hesitancy talking themselves, ask them to bring your husbands and we can have a meeting, like that. So that is very important. So what are our learning objectives? That we have to define the wellness, that we need your help. We need our females in a good health. And we should be able to organize and conduct a breast health awareness program with your own setting in our areas, in our, circle. If we are belonging to third world countries, we should try to approach whatever best we can have in that area. If we are residing in first world, so we can go in towards that side, whatever we have in there. So we have to approach how the people are living there, what is their mentality, up to what level they can understand. We cannot bombard them with the, the knowledge and all that stuff. If they don't understand, if we can't communicate well, we cannot create awareness. So we have to have a very good communication with all the females and all the patients suffering from breast problem, So promote breast cancer awareness to staff nurses at hospital levels, discuss anatomy functions of breast, is like identify significance of breast examination, very important, demonstrate technique for breast examination. So if a female comes to us, okay, she's 30 or 25 or 40 or 50 years old, the doctor or the midwife should know how she should do the breast examination. She should tell them either on lab computer, or they should have a chart there in their room. Just tell them, do like this, and don't worry. And this is yourself, you will be doing it, And so our takeaway lesson is feel less fearful, more harmful about breast cancer, because it is a curable disease. If we get it diagnosed early, we can catch it early, we can cure it. Incorporate best health habits into a total wellness program. Perform a breast self-exams competently and with confidence. Be assertive about reporting a breast change to healthcare provider, promoting early detection. So if we say our basic thing is the early screening, we have to promote screening in our society, wellness programs, breast self-examinations, and we have to educate our females in their language, in their level, at their level. Then it should be like, maybe we can succeed, in creating awareness and seeking good help for them and helping them out if we want to be. Thank you so much.
Thank you so much for a wonderful and such an insightful presentation, Ms. Tayyba. I hope many of the viewers right now must have taken away so much from this. And of course, it is, I feel like the entire objective, or the most important point about the whole presentation was how we can mitigate and how we can catch the source of the disease from the very beginning by screening. And I absolutely love how you emphasized on the screening part, and then how annually you get all the procedures and the mammography done for free for those people that can't afford it, because obviously since it's a developing country and we have many rural areas, and there's not enough, the literacy rate is very low, so these all add to the picture. And this was an absolute very, very, very insightful session, I must say. I think I'm going to pass it on to Miss Rochelle right
Thank
now.
you so
And
much.
we're going to
I
move
would
on
just
to
like
the...
to add one thing. Sorry, I'm interrupting you. Like, although we are educating our females, because we are only talking about our country, a third world country like that, because here in developed countries, the males are same participating as the females. But in our countries, our females, they are very fearful of their husbands or fathers, you know. So we have to educate the males also. If you are with them, they will come to us, they will get it treated, you know. And if they will be getting it done earlier, it's for your sake also. Yeah.
Absolutely. Absolutely. So now I'm going to pass on the floor to Miss Rochelle right now. Since the whole session was also about resilience and mindfulness, and Rochelle has spent, I think, most of her professional life working with resilience, and she is a yoga instructor, and it has everything to do with how you bring peace to your mind. And of course, the external factors, the physical factors, they add to your immunity, but obviously how your mind works, and everything that happens inside your mind, that is also very important. So I think the floor is open to you, Rochelle. However you want to take the course, whatever you want to add, we would love to listen to it. Thank you.
Thank you so much. Oh my gosh, Dr. Tayyba Ali, that was really powerful and so useful. Thank you so much for all that you're sharing.
Thank you so much.
We all need to hear all of that and more often. So thank you so much. And if I would, if I may, I would like to just begin our time together by guiding us in a brief mindfulness practice as we get started, to give ourselves a couple minutes just to check in and tend to what might need tending to. I understand we're right at the end of the hour, so I understand if people need to go. And I, don't plan to go too much over, but so just when you're ready, allowing your eyes to close and bringing awareness to the breath. So that's the actual physical sensations of the breath, feeling each breath as it comes in and as it goes out. Just letting the breath be just as it is, without trying to change it or regulate it in any way. Allowing it to flow easily and naturally with its own rhythm and pace, knowing that you're breathing perfectly well right now and that there's really nothing for you to do. And I invite you to bring awareness to your body. So we're sensing into the body just as it is, just like we did with the breath, not needing it to be any other way. We're really just falling awake to the full dimensionality of your being, sitting here completely as you are and complete as you are in this moment, with your fears, your difficulties, and also your delights and your uplifts. What we're working with is really dropping our awareness into a domain of being, out of our usual mode of doing, to become aware of the sensations of your body, really tending to whatever is here, whatever's needing tending to, and not needing it to be any other way. So if there's restlessness or tension or anxiety, all of that is welcome. All of that is a valid human response to all that is unfolding for you. It's really about putting out the welcome mat for whatever is here, even if that includes a whole range of different emotions and feelings that you might be experiencing at this time. And so if your eyes are closed, I invite you to allow them to open slowly and allow some light to come in. And I'd love to hear from you, to hear your voices and to get a sense of what's here for you. If you're on Facebook, you're welcome to put, so what I'm going to do is share a poll. And for those of us on Zoom right now, what you'll do is the poll will pop up for you. And so you're going to select, it says, which of these emotions have you felt in the past 2 weeks? And so you're going to just, select all that you've felt so we can get a sense for what people are experiencing. And then if you're on Facebook, you can type it in the chat if you prefer to do that. So I see sadness, anxiety, despair, fear, anger, so it looks like anxiety and sadness are about 50% of our group is experiencing that, 57% for sadness, anxiety, frustration, and fear. So if nothing else I'm going to share the poll so everybody can see. We'll share the results. That this is our human condition right now, considering all that we're going through. And I've been saying this for many years because our lives are incredibly complex. And that's, for the general population. So imagine adding breast cancer to that, and to everything else that people are experiencing in these times with the pandemic and everything else. So our mindfulness practice is in part about building our capacity to bring awareness to all of our emotions without trying to numb them or subjugate them. We're just noticing when we might fall into habitual adaptive patterns. And okay, I'm going to pull that off, just end that. Okay. So in some cases, we may numb or block or shut off to the experience, and really as an adaptive response to stress, to anxiety. As you probably know and imagine and feel yourself, is that anxiety, fear, sadness, all of these things, we tend to have negative feelings about them. Whether that be cultural, our culture taught us that we are not supposed to be angry, or we're not supposed to be sad. All of these things we tend to, not all of us, but I don't mean to generalize, but often, and what I've noticed in, teaching mindfulness to hundreds of people, is that these are common experiences. And so our practice with mindfulness is really sort of coming out of automatic pilot mode. And we're coming into, a greater awareness, and we're not just building awareness of our experience, but we're actually, there's specific attitudes, this gentleness, like the loving mother that so many of us maybe did not have because she did not have that loving mother. But we can actually evoke that loving mother, turn towards our human experience, tend to what is here. And it's a radical act of sanity in the sense that if for no other reason than it's here, then that's our experience. And then we are learning to just honor that, acknowledge it. And in that process, we may, a side effect of that is that we may experience greater degrees of ease and well-being. Just as you would imagine, having the loving mother tend to your sorrow, your tattered heart, to your anger, to your grief, to your anxiety, all of it. And so we can be that loving mother for ourselves. And so I have another poll I would love to share, just because anxiety is generally a big one for so many of us, particularly in these times. So let me see if that one was closed. And I believe I already shared that. So I think you've all seen that one. Let me see if there's, oh, here we go. Poll number 2, excuse me. Okay, so launch this poll. So the question is, how do you know when you feel anxious? So our mindfulness practice can give us a chance. So please select all that you would like to, that resonates with you. And so again, our mindfulness practice gives us an opportunity to become aware of anxiety, and also when we might just feel anxious. When do you know? How do you know when you feel anxious? Says feeling tension and tightness, maybe a pit in your stomach, nervous and jittery. If you're on Facebook Live, you're welcome to just put it in the chat box if you prefer. Increased heart rate, heart palpitations, breathing rapidly, sweating, or a sensation of prickly heat. So they're still coming in. It looks like tension and tightness is a big one for people. 75% of you are experiencing that. There's also another top one is that sense of panic, nervousness, and jitteriness. So I'm going to end the poll now and share the results so you can see that. So mindfulness gives us a chance to acknowledge when we feel anxious. Again, we are not trying to push away our anxiety. We're not trying to numb it, subjugate it, block it. We are really tending to it with gentleness and care. We're acknowledging that it's here. And again, if for no other reason than because it is here for us, and that with, we are actually building neuroplasticity for kindness and compassion. So that every single time that we notice what's here, that we actually put out the welcome mat for it, that we're actually tending to our own tattered heart with love and compassion, that we are actually building neural pathways in our brain for kindness and compassion for ourselves. These are powerful healing antidotes to being judgmental, critical, hard on ourselves. These are powerful practices in and of themselves, and they are a foundation of mindfulness, of integrating mindfulness into our lives. So I think I've already shared that. Let me stop sharing. And I have one more poll to share. And so I'm going to launch this poll. This question is, what exacerbates your anxiety? Mindfulness gives us a chance to notice what might exacerbate our anxiety. And so if you're here with me still, you can choose all that apply for you. There's when I'm tired, when I'm hungry, when I'm not able to get a need met, or maybe more than one need met, when I feel stressed, overwhelmed, when my mind might be all over the place, whether that be in ruminating about past experiences, or maybe ruminating about what might happen in the future when we really don't know what might happen in the future. And so our mindfulness practice can help ground in the moment with the sensation, the physical sensations of our breath and our body, as we expand our awareness to hold gently the sensation of our breath and our body. So some other negative states of mind, when I'm resisting what's happening. So a top one is when I feel stressed, exacerbates anxiety. And again, we are not, mindfulness is messy. We are not trying to push away anxiety or block it or subjugate it or alter it in any way, really. We are really turning towards it and just allowing it to be here. And in that process of it's self-care. It's like an ultimate self-care of just tending to what's here without needing it to be any other way, is an act of care for ourselves. So just a couple last things I might like to say is related to the question around getting our needs met. So it's helpful if we can begin to bring awareness to when, what needs we have, some basic needs that we have, and maybe journaling about it. And one basic need is a sense for safety, which is in discord for many, if not most of us, because of all that's unfolding. And so, it's actually always in discord, because a basic need for safety is in discord with this reality of life that's always changing. And so there's always this, it can feel, can make us feel like we're maybe out of control in some ways. And so mindfulness can give us a chance to really just ground ourselves in our body, using the sensations of our body or our breath because our body only ever exists in the present moment. And so it's a powerful anchor, almost like a life jacket, particularly when we're in the midst of such storms of life. And so working to get more and more of your basic needs met, maybe becoming like needs literate for you. You're the only one that knows what needs you have. And that could be even just as simple as taking, when you're thirsty, you take a drink of water. You are getting a basic need met for your thirst. And so then you can expand that all the way through, physical needs, spiritual needs, emotional needs. And so I invite you to really explore what those needs are and to begin to integrate more self-nourishing behaviors into your day-to-day life in really practical ways. And so mindfulness can, assist us in helping us get clearer about our basic human needs and can help us navigate the terrain of just getting our needs met. And so in conclusion, some of the simplest needs, just that the needs, getting our needs, more needs met, introducing more self-nourishing behaviors in our daily lives, integrating mindfulness seamlessly into your daily life. So when you're brushing your teeth, when you're taking a shower, when you're washing the dishes. And then there are more structured, formal practices of mindfulness that you can get from some really great apps online if you want to use technology. Insight Timer is one of those. Breathe is another one, and there's another one called Headspace and Calm. Those are a few that I know of. And there are also, you can Google or search body scans, mindful movement practices. All of these are really helpful. And of course, the ancient practice of yoga that has an incredible history and depth to it. That's another wonderful practice to integrate into your life to help to navigate, to build resilience and navigate these difficult times. And then just a final note about mindfulness is that it's not about anesthetizing ourselves. It's really about coming to terms with the actuality of things as they are, for tending to your anxiety with care and understanding, and then expanding our perspective that whatever response that you're having now is valid. It's a valid human response. Awareness of stress reactivity versus responding, and without judgment, and then also building the neuroplasticity for self-compassion, gentleness, and kindness in your life. And maybe even, if you want to join me for a last brief meditation, sometimes I'll put my hand on my heart if things are, feeling particularly overwhelming. As I turn towards my experience, just sensing into the breath, just allowing the breath to be just as it is, sensing into the physical sensation of the breath, feeling each breath as it comes in and goes out, letting the breath be just as it is without trying to change it or regulate it in any way. Just allowing it to flow easily and naturally with its own rhythm and pace, knowing that you're breathing perfectly well right now and that there's nothing for you to do. And just allowing the body to be still and sitting with a sense of dignity, a sense of resolve, a sense of being complete, whole in this very moment, with your posture reflecting this sense of wholeness, embracing the full dimensionality of this moment completely as you are and complete as you are. And so thank you very much, everyone, for taking part in this webinar and for your active participation. If there was one final parting thought, is one thing that you would want to do to bring breast cancer awareness and mindfulness and resilience into your day-to-day life as a result of participating in your webinar or in this webinar. And look after yourself, and I hope to see you next time. Thank you so much.
Thank you so much. Thank you so much, Rochelle. I think this was such a calming journey. I think this was like your voice with the content that you delivered just now. I think that in itself was imparting this some level of mindfulness, just you talking and you giving us all of that insight. I think I think now everyone that's watching us right now and with us right now, thank you so much for everyone that has been watching from the start. If you have any questions, if there's anything that you want to ask the experts over here, whether it's any other method that you want to get their insight on, or their views on, please come forward, ask the questions. Amanullah, I can't see the Facebook comments right now. So if there are any questions over there, please read them out loud, because I can't see them. My laptop just died on me. I'm so sorry. Um,
Sure, I will.
Okay, so there is just one question I want to ask you, Rochelle. So there is this method that I found out about belly breathing, and I wanted to know how useful that is in order to like bring calmness to your body. How useful that is, the method of belly breathing.
Yeah, so pranayama is a breath, and it's an ancient Indian breath awareness practice that is so powerful and deeply healing. It's ancient, it's deep, and I mean, it's I recommend anyone look into it. If it resonates with you and you're interested in working with those practices, by all means, wow, go for that, do that. And I also, and so yes, we do know that it can actually stimulate the parasympathetic nervous system response, which activates a secretion of oxytocin, which is one of the most powerful hormones it's called the tend and befriend hormone, which is it feels like it's connecting, it's grounding, it's keeping us connected to ourselves and to our loved ones. And so just these breath practices, just like you're talking about belly breathing, anything that can get us out of the constant mode of the mind. And that's not to say that the mind is bad or that we're doing something wrong. When the mind is all over the place, it's an adaptive response to our complex lives. We are trying, our little brain, our mind is trying to hold it all together. It's trying to do the best it can. And so it's no wonder that when we come to be still, that we're going to see the mind is all over the place. So we're not trying to stop the mind from doing anything. We're just noticing that it's all over, and that's totally fine. You just do what you're going to do. And then I'm staying here. So I'm going to use that belly breath, or I'm going to use this, it's the basic sensation of the breath or the body. Like you can feel your feet on the floor, your bottom in the chair. And so the mind can do whatever it wants to do. I'm just going to come back. And then maybe we get lost again. The mind goes again all over the place. And then we're going to, with gentleness and kindness, we're going to bring that awareness back into the belly and into the breath. It's powerful way to ground ourselves. Every single moment we might notice if we feel like we're getting overwhelmed. So that connection to our body, when we notice tension or tightness too, this is another really powerful practice. When you notice tightness, maybe in your jaw or your muscles around your eyes or your shoulders or your belly, see if you can allow those to relax and release. And it's really significant. People don't realize how powerful this is, but it can shift our chemistry instantly. And again, it's not as a way to like get away from our stress or try to block it or numb it. We're just noticing that we're stressed. We're noticing we have this tension. We also know that, okay, I have a choice. I can see if I can allow some of this to release and relax. And so by all means, if we're able to do that, then let that happen. If not, though, if the tension feels like it's staying, that's okay. We're going to stay. It's like riding the wave of the anxiety or the tension. We're just going to stay with it and then stay with the breath, coming back to the breath. And the breath is so powerful. So thank you for that question. It's great.
Yeah, because I recently found out that most of the times when we feel that stiffness in our body and we feel tired all the time, it's because through chest breathing we're not taking as much oxygen as we were through belly breathing. And that was such an important information that I came across. I just happened to come across that, and ever since uh, of course, it's very difficult to effectively do that because we're just used to the chest breathing. But yes, every time I feel stressed and I start to difference. And of course, there's another thing that Rochelle mentioned about those using technology in order to meditate and get that mindfulness. There was this one application called Headspace. I personally vouch for that application. I've used it and it has helped me a lot. And I think all of us should definitely, because it's connected to everything in our life. It just sets the mood for the entire day. If there are any questions for the people that are watching right now, if there's anything, Ms. Tayyba, that you want to add right now, that you want to go over once again, please come forward and please voice it. And other than that, if there's anything, please come forward, because now we're going to go to the conclusion of this beautiful hour-long session.
Important thing is like what I feel here, because I'm residing here in Australia for last 4 years, and I see a drastic difference in our health system and Australia health system, or America or Canada, or like that. The basic difference which I see is we don't put major effort in educating our people in every aspect of life. We just try to make like a man, machinery man, just to work, that is, and female just working in four walls, and that's it. So we don't educate them about life, about their health, about their importance. We have to create awareness in our females that they are important for us. Their health is very important for us, because they are important for kids, for their family, and definitely good nations, So basically lacking is awareness in our society very much at every level. And we have to start from the grassroots level, from our rural areas. Those are the most females, I think they are suffering a lot. Even young ladies, they are suffering a lot. Their deliveries are there, home deliveries are going on. Here also home deliveries they are doing, but in very well established manners. Here, even if they go for home deliveries or something like that, they have very, very good systems, They have educated midwives only for home deliveries. And the midwives who treat in hospital, they are separately trained. So like we have to start from grassroots level. And the most important thing comes our government, how they are doing, what they are doing for our people, They are poor, they have socioeconomic problems. Why we can't deal with them? We have to solve this big problem at their level. We should ask them how we can help them in their socioeconomic status, We have to raise this thing there. But unfortunately, it's not like that,
Yeah, I think it's just the health sector in Pakistan. It's just in not the most, I'm gonna say, ideal condition, and I think it's one of the major reasons why Pakistan faces a lot of health issues, specifically women.
yeah.
They have a lot to suffer, and they're deprived of their healthcare facilities,
Yeah.
which is a very long and a very detailed conversation. But Ms. Tayyba, I have some very important topic for you to address, which is myths regarding breast cancer. And there's this one question that just came in, and it's okay, I'm just gonna read the question to you right now. The question is, does wearing a bra be one of the causes of breast cancer?
I can't hear you.
Okay, am I audible right now?
Yeah.
Okay. So the question is, that does wearing bra at night can be? That's a question that came in.
Can be what?
Wearing a bra at night while sleeping, can that
Can that be a factor of developing of breast cancer? Is this the question?
Yes. Yes.
Thing is, ideally, whenever you are sleeping, you should be sleeping in a relaxed dress, loose cotton clothing. You should not wear undergarments, male or female both, because our body needs definitely aeration. And if it is summer and you don't have air condition with you, aircon with you, so body is sweating, and like that, if you're wearing tight dresses, definitely it starts smelling and producing different type of sebums and secretions, which can give you different type of diseases. Before, there was used to say, okay, the wearing tight bra at night can create a problem or can harmful for. But now they have changed this research. Recently, I was just reading. I wanted to add this point, but maybe I forgot. Now they have changed this one. They have said it's not much effect. But yes, whenever you are sleeping, you should sleep in loose cotton clothings, like in summer or winter, whatever you want to wear. But don't wear undergarments. That is good for your body aeration, actually. Hope I answered.
Absolutely. Okay. So if there are any other myths that you have that you want to address or that you want to go over, please, I would like you to just educate us.
Myths like, they think in our countries, they think like breast cancer is a disease of old age, although it is a disease of old age. But when I tell you 15 years back or 10 years back, when I was doing my fellowship, I have seen breast cancer even in 18 years old girl. I still remember 2 females we had of 18-year-old girl, they have the breast cancer and they didn't have any family history. Similarly, I saw breast cancer in 30 years old ladies. So we cannot say it is a wholly solely disease of 50 years old ladies or old age. If we talk about the invasive lobular carcinoma, it's an early age cancer. So it can develop earlier, and especially, as I told, if there's family history, so age doesn't come there. If there's family history, if she's 18 years, she can have the cancer. So that's why we have to educate our young females, rather as they start puberting. Okay, 18 years is fine. You can start educating them breast self-examination. Till their death, they should do the breast self-examination, And this is I will say the best way to diagnose the breast the CA breast, because you yourself are doing. You are not asking anybody else to come and check me and see if I'm having any disease or not, So if you will get it diagnosed early, then you go hurriedly to the your GP or your doctor or whatsoever you trust and just talk to them. Oh, I'm having this one. I get it diagnosed, and get it diagnosed as early as possible, so that you can get it treated at the root level and you can get it cured, as it is a curable disease if it get caught earlier, And secondly, it is not only female cancer, as I told. Yes, there is 1 to 5% chances of having male breast cancer also. So it is less ratio, but there are.
I'm sorry, I disconnected. Ms. Tayyba, okay.
Yeah.
So have you concluded? Your topic?
Yeah.
Have you concluded it? Okay.
Yeah.
I'm sorry, because
like,
my internet disconnected.
Yeah, no, it's okay. I will just say, like, it's I would really always be very glad to help my people, my females, if I can, because I'm sitting here. But when I was asked to go for it, so although it's very late night time, and I said, no, it's fine, because it's good if you can help someone and you can create awareness, and if they can get something good from you, because we are doctors. So what type of doctor we are if we cannot create awareness and we cannot provide them benefit? But again, important thing is like, I would like my females to come forward and to take care of yourselves, take care of themselves. Just think that you are important, not for others, for you also. You should like have to live a good life. And if you will not take care of yourself, nobody will take care of yourself. So give importance to you and your life also. Thank you so much.
Thank you so much, Ms. Tayyba, and thank you so much, Ms. Rochelle, for your time. I am sure the time zones are very different. It's 6 p.m. in Pakistan right now. I don't know what time zones you guys are in, but I'm definitely sure it might be really late. Thank you once again for taking out the time and for this profound knowledge that you all have shared with us. I'm sure everyone that's watching right now must have taken away something from this hour-long session. Thank you for everyone that's watching right now. I think now I'm going to conclude this hour-long session. I think I'm going to conclude the hour-long session. Thank you so much, everyone, for joining, and take care, everyone. Have a nice day. Bye-bye.
Bye-bye.
Bye. Thank you.
Bye. Thank you.